Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then skin manifestations of what are the skin manifestations of chronic renal failure? So skin manifestations are due to here in chronic renal failure there is increased urea. This urea starts to accumulate in the skin. When it accumulates in the skin, it results in pruritus. Then the patient will also have ecchymosis. Ecchymosis is seen in the patient along with hyperpigmentation is seen. This hyperpigmentation is actually it is an yellowish hyperpigmentation is seen, and this yellowish hyperpigmentation is mainly due to the retention of urochrome. Because of the retention of urochrome and discoloration, so because of this you see hyperpigmentation. Now one, there is retention of urochrome, and discoloration is also seen mainly because of hemochromatosis. Here in hemochromatosis there is breakdown of hemoglobin, and this will result in bilirubin formation, excess of bilirubin, and this is responsible for the hemochromatosis. And there is hemochromatosis, there is excess iron is also present, so that excess iron will give rise to that brownish color pigmentation is seen. Now here in the skin, again there is in the nail we have a syndrome called as nail and half nail syndrome. We have nail and half nail syndrome, which is also called as Lindsay nail. Here in nail and half nail syndrome or Lindsay nail, here there is increased capillary density is seen, and this increased capillary density is seen at the distal half of the nails. So this is nail and half nail syndrome is seen, which is called as Lindsay nail. Now the patient has pruritus. So how are you going to treat the pruritus which is seen in chronic renal failure? The treatment of pruritus in chronic renal failure is, in the pruritus you will have to treat it with the help of dialysis can be done, because when you do dialysis the whole urea and the waste materials will be lost in urine, so that the urea which is accumulated is also lost, thus treating pruritus. Even UV light can also be given to the patient. And there is something called as, there is one reaction which occurs in the skin which is called as fibrosing dermopathy. Okay, in fibrosing dermopathy a fatal skin reaction occurs, and this is a fatal skin condition. Here the patient develops nephrogenic systemic fibrosis. In nephrogenics, it is a fatal skin reaction which develops due to nephrogenic systemic fibrosis. That is, in nephrogenic systemic fibrosis, the fibrosing or fibrous tissue gets accumulated in the subcutaneous tissue. So as a result you will see presence of subcutaneous indurations are seen. These indurations or hardening of the subcutaneous tissue occurs due to the deposition of collagen and fibrous, and this subcutaneous induration is mainly seen in the arms and legs. This fibrosing dermatopathy is actually seen in chronic kidney disease, and it is most commonly seen on those conditions or those cases who are on dialysis. Then, if there is any exposure to magnetic resonance contrast agent, if the patient is exposed to any MRI contrast agent, like if the patient is exposed to gadolinium, so this gadolinium can precipitate the syndrome.
thank you and thank you for watching.